Well, joining me is the president and founder of Empire Medical Training, Dr. Lorena Cosentino, and the vice president of Empire Medical Training, Lorena Cosentino. It's great to see both of you.
Yes, thank you. Nice to see you as well.
It's my pleasure. Thanks for having me. Let's start with differentiators, okay? We know that these seminars are very hands-on. We know the education here is top-notch, but what are some of the other things that really make it out of this world?
Yes, for sure. First of all, how long do we have? Because that's going to take me at least 2 hours to talk about.
High level.
But thank you for the question. So absolutely, you know, one of the things that people, when they contact us, they ask us very, very specific questions about, you know, the neurotoxin course and what am I going to learn? And at the end of the day, I mean, yes, those things are important. But at the end of the day, yes, you're going to learn how to inject botulinum toxin or dermal fillers. But what's really important is to understand what you're getting from a company. You know, what's the support that you're getting, in our case, Empire Medical Training? And this is something I'm very passionate about talking about because we've been doing this now for 27 years and we've trained over 175,000 practitioners, physicians, nurses, nurse practitioners, dentists, PAs, mid-levels, all sorts of people. Probably one of the biggest, there's so many, but one of the biggest differentiators is the support that we give them after they attend the program. So how many times that you go to any kind of seminar and you leave there and you have that one additional question or you forgot something or maybe you just didn't understand something. So we have a post-mentor program that the practitioner could get on the call and it's a Zoom platform. They could ask their questions and they could really get that support. So they have that and they can really make sure that all their questions are answered. Something else that's different is our professional membership. With all due modesty and everything, there are so many companies that are constantly watching us and they try to imitate, and you know, that's, how is that expression?
Highest form of flattery?
Yes, yeah, yes, thank you. Is copy, you know, and it's really difficult, if not it's possible to copy because we have now 52 courses.
56 courses. And
56 courses.
on different specialties.
Across 4 different specialties.
Yeah.
So it's aesthetics, it's functional medicine, it's case management, business and marketing, general surgery, and general medicine. Actually, those different specialties. But our business curriculum, if I could say a few words, a lot of the practitioners that are getting into, let's just take aesthetics as an example, they don't just want to learn how to perform the technique. They're doing it because they want to be successful in their practice. And to be successful in their practice, they have to learn about social media. They have to learn about the ROI. They need to know all these different things, even if they don't plan on, let's say, opening up their own practice. Maybe they want to be hired by another practitioner, but they still need to know how to sell the procedure, how to explain it to their patients. So the business, the marketing is very important, the post-support, our membership, our professional membership model is very important.
How about our vendor our vendor partners?
Vendors. So that's very important. When you come to an event, it's not like, I don't want to mention names, let's just say competitor A, for example. They're going to be sitting around with maybe 5 other practitioners, 10 other practitioners. Here, our programs are events where you're with a group of people. There's vendors, there's other like-minded individuals. It's not just a 1, 2, 3 type of thing. You're getting the whole package. You're learning everything. And I think
you're also getting incredible discounts, you know, just because you're a member from Empire Medical.
Oh, sure. Interacting with the vendors themselves, right? So at some point, they're going to need to buy the products, whether it's the neurotoxin, the fillers, or if laser management or laser. You know, so it's our close partnership with our vendors. I think that's very, very important.
That's very valuable. Yeah.
We also have with our aesthetics. No other company has this. It's a model. It's a fast track program where we think about this and we get all of our ideas. And the funny thing is, as much as I like to take credit, we like to take credit for the new courses and the new programs that we create. The reality is it's not our ideas. It's coming directly, you know, from our audience. And they tell us, they say, listen, that level 1 course was great, but I need something where the whole day it's immersive. And we create a program.
We really, you know, something special about us. We really love going to their programs and really try to get as much information as we can for our own attendees, right? Because I think that proximity really will give us the most information so we can go ahead and put it back into their hands, into other practitioners that are joining the membership plans that we offer, or just if they want to take one class or 2 with us. Yeah.
I told you I needed an hour to finish this book, but just couple of things.
So many
I
benefits.
wanted to mention, and this may sound kind of small, but it's really, really important. We have a very professional members platform. It's our My Members portal. On this platform, there's hundreds, if not thousands, of support videos. How to inject masseter muscle, how to inject facet blocks, how to inject a sacroiliac joint injection, functional medicine, how to prescribe testosterone safely. You know, there's, like I said, hundreds, if not thousands. I haven't counted lately. We have our on-demand platform, which is also massive.
Massive.
They could get their certificate from the members portal. They could, find answers to commonly asked questions.
3 times a week, we offer webinars with different partners also, so they know about technology and what is really out there, also in business, our own classes. So it's really
How often do we have virtual programs? We have a whole virtual series. If you can't attend the live programs,
weekend. We do have virtual courses every weekend. If you cannot come and attend some of our live courses, you also have the chance to, go to a virtual courses. That is a great, benefit.
You both mentioned the spirit of community, and I think a really good indicator of that is that many of your teachers started out as students, which I think is pretty cool.
Yeah.
that is kind of cool.
It's very cool and rewarding as well, because a lot of our now KOLs or instructors that we have currently, they started with us, years ago. Actually, when Stefan used to teach, they took classes with him. We're talking about maybe 7, 10, 15 years ago. And now they're actually giving back to our community, and they're just also instructors for our company, which to us, it's a great, I don't know, it's so super rewarding,
It
to
is.
see them here.
To hear the success stories. A lot of these doctors that I'm mentioning names are in the industry. They're very well known in the industry. They're famous KOLs, and it's very rewarding to see them out teaching, to do what we're doing, but to know that they started as a student with us. It's very rewarding.
And in the spirit of networking, I know that oftentimes students of yours end up meeting their future business partners here as well.
Yeah, because that's so true. They come as a nurse practitioner. They want to work with a medical director. They want to work with somebody else. So that happens a lot of times.
That happens a lot, actually. We have like a lot of our members that they came, at these events, and they just partnered together, and they have very successful practices. And they took not all of them, but most of our classes as well. So yeah, we'll see that pretty often.
What would you both say to somebody watching who's thinking about taking a class or becoming a member? Why should they do it? In addition to everything we've already covered here today.
Good question. Why do you become a member? Probably because of the support while you're at a program, the post-training support, and the resources that we have, and the way that we package everything so that it's affordable for them. Because as you were mentioning earlier, training is expensive.
Yeah.
All of this is expensive. So to be able to package this in a way that gives them the most, for their investment.
And I have something to say also, that we're not just a company that will do just Botox and fillers class, which there are a lot of them out there. We are really like the whole package. Like people nowadays are so busy that when you want to get a procedure done, you don't want to get just Botox or fillers. You want to maybe get lasers or skincare or a body treatment. So that's who we are. We offer training on like most aesthetic procedures that are out there, and we're always adding new techniques and new classes at what's trending. We really try to go, and that's something that I love to go. We love to go to different trade shows to see really what is out there that is really trending in the industry, because as we all know, medical aesthetics is going so fast. We're always getting new products like exosomes, biostimulators. It's always so much out there. Before it used to be just Botox and fillers, and now it's much more than just Botox and fillers. So
Absolutely.
we are a company that offers
Everything. And it's true because, again, not to talk about competitor A or competitor B, but the reality is the majority of let's say the other trainers out there, their focus and their limitation is they teach Botox fillers, maybe Botox fillers in one other course. And that's not what we do. We have courses from entry level, which are the neurotoxins, the dermal fillers, the PDO threads, all the way up to anything advanced that you could think of. We even have liposuction courses.
Right.
We have submental liposuction courses, very, very advanced.
And you have events all the time, every weekend, all over the country, now internationally.
Really, all over the country, like you mentioned, Pete.
Yeah. So, we're talking about like every weekend, yes. And really like we are very blessed that we have an amazing team because every weekend we have between 2 to 3 courses in different states. And of course, we're very proud of that. Not all companies offer so much training as we do. And talking about international, that's something that I really take ownership, especially because I speak Spanish. So we're really trying to get into most countries of Latin America. We already did it in Colombia. Now we're going to be going to Mexico and Peru and pretty soon Panama.
Wow.
So
That's so exciting.
just going to Latin America, it's not just the experience, but the fact that you are exposed to other techniques, different procedures, because a lot of times what it's there is not here yet because of different legalities and FDA approvals and all that. People in South America countries are very, very academic. They care a lot. Not that we don't care here, but over there is a little bit more rigorous.
Yeah, you're not going to learn
than-
business. They're not going to teach you social media. You're
No.
not going to learn business.
They don't want to, they don't want to know pricing, nothing like that. It will be just all about academics and how to treat your patient.
And the caliber of, and it is the physician instructors, the
So-
caliber of the training is also very, very high.
Whoever we're choosing to become partners with Empire Medical Training in South American countries, they have to have a caliber, of course, and expertise in their countries. So very excited about this project.
Why is it so important that a student learns as much as they learn, as many different treatments as they learn in your training?
So that's a big differentiator comparing to us, to our competitors, because we do offer like 56 different courses, not just in aesthetics, but also anti-aging and wellness, functional medicine and pain management. But the reason why is so important, because really, like, the patients out there are super busy, right? And if you just offer Botox or fillers,
And they're not coming in just asking, I'm here today
No.
for Botox and fillers.
Right. Maybe they come in just for Botox, but then once you see them and they get into the aesthetic field, they're gonna maybe wanna do pediothreads because their best friend told them so. And if you don't offer it, they're gonna go to somebody else. You don't wanna refer your customers to another medical
Especially,
practice.
Imagine referring your aesthetic patients to
Yeah.
another aesthetic provider.
Yeah.
You're going to look like you're inexperienced and you don't know how to do those procedures.
Correct.
What are some of the procedures? Can you go over some of the procedures that we teach
That we
other
teach?
than
Oh,
the botulinum
okay.
toxin and the fillers?
Of course, we offer mesotherapy, which is great for body and face. We offer sclerotherapy, facial aesthetics, which is about everything about
That's
skincare.
foundation. Okay.
We offer PRP for aesthetics. We offer IV nutrition. We offer anti-aging. We offer hormones, weight loss.
We have advanced procedures for every topic. So advanced
Sculpture.
Botox and fillers, sculpture, radius,
Biostimulators,
body
of course.
contouring,
Yeah.
micro
Lasers.
injections, micro injections.
Cosmetic lasers. Yeah,
Advanced
there's
lasers.
advanced lasers. We
So
offer
it's for entry level, right, or people just starting out in aesthetics.
all the way
up
to
the most
advanced.
And the same thing with functional medicine, and the same thing with pain management.
Correct.
Starting out at, let's say, entry level. We shouldn't say a practitioner is entry level, but they're learning new procedures all the way up to the most advanced.
Important question. What treatments do you offer the people who interview you on camera? Specifically this person. Is there a whole slew of treatments that you think, just, hit me. What do I need? What do I need? What do I need?
Should I start or you start?
There you go.
How much time do we have?
Okay, well, definitely, Dave.
Okay.
Okay, you need to start at least doing Botox.
Okay, all right.
You can be one of our models.
Fair enough.
Yeah, that would be good.
Wait, that's it? You're being nice.
No.
She's just getting started. Yeah, she's going in alphabetical order.
You'll need maybe a little bit of biostimulators, forehead and around the cheek area. Why not a little bit of derma fillers?
Why not?
Remember in the old days, it's funny, when somebody had nasolabial folds,
Yeah.
what did they do? They injected the nasolabial fold. That is so old school and outdated.
Yeah.
That's not typically done. Now you inject other areas of the face to comfort.
Lips. And why not a laser treatment or a chemical peel or hydra?
That's what I'm saying. Why not?
Why not?
I mean, we're here already. Yeah, that's right. It's right. All right, let's do it.
I will say that, yeah.
Okay.
And that's just the start.
Just to start, yeah.
Anything on ROI that we want to talk about? Now that we have you here as a patient, let's get into the ROI on CL. But
Not
I mean,
just the host, I'm also a patient.
There you go.
but aesthetics.
We got him hooked.
It's so profitable. Aesthetics. I mean, it's I used to do pain management back in the day, and it's a very rewarding field, right? Because you're helping people, they come in with pain, but something about aesthetics, everybody is happy. The practitioner is happy, you're dealing with happy patients. The patient is thrilled, they walk out of there thrilled.
Yeah.
The nurse, the nurse is, everybody's happy. The practitioners are making a lot of money because it's so profitable, and the patient is ecstatic.
You know, to that point, what do you find in terms of practitioners who come to you that never thought about doing aesthetics, but now they are? Why? Is it because they can make their patients happy, because it's lucrative?
It's such a trend. Like everybody nowadays are really doing some type of anti-aging procedure, because it's everywhere, it's like the new type of world that really we're living,
happening.
especially in different states, right? Like
Oh, yeah.
Miami, New York, LA, there are some states that they really into the aesthetics. And
But the healthcare industry hasn't seen a change. It's been going progressively down for year after year after year. That practitioners are not happy with their reimbursement, especially if they're in general medicine or if they're a general nurse working in a hospital. So most of the practitioners that we see coming to us want to change their career. They're not happy. They're underpaid and overworked. So they're looking for something that they could, balance, a lifestyle balance, balancing their life, what they're doing with their work. So I think that's probably a big thing that we do that's a little different.
I know there are some healthcare professionals who are reluctant for whatever reason to get into aesthetics. In that case, are there essential courses that they would need to take?
Absolutely, absolutely. So I think most people that are getting into aesthetics, they know about the neurotoxin level 1, they know about the dermal fillers level 1, but there's 2 courses in particular that I'm thinking about that are very, very important, and it'll solve their problem. It'll solve the answer, because you're right. So many practitioners, they hear a story or they hear a rumor, and then they're scared. And the reality is, if you learn how to do these procedures correctly and safely,
yeah,
the technique is very, very safe overall. So the 2 courses I'm thinking about that we have, one is the Complications Mastery Program. And what that program does is it teaches you safe technique. It teaches you the anatomy. It teaches you not only how to treat a complication, but how to prevent a complication. And you do this in part by understanding the anatomy, understanding the depth of the needle, understanding how to inject. That's a very, very important course. It's actually one of our more popular courses because, again, when you take this, it's interesting how people feel after that. They start to gain confidence and they understand that it's very doable.
yeah, and
So
that we avoid complications, right?
That's the goal. The goal with that program is, but of course you want to know how to treat things, all right, but also to avoid it is the most important thing. The other fundamental course that's also equally important is our facial anatomy cadaver course. And that is one course that over the years, we continue to evolve and improve. Initially, it was just an observation course. It's now become a hands-on course. We have dyes that we inject throughout the cadaver. These are actual cadavers that we use, and it's a very, very intensive course. They're always taught by either a plastic surgeon or in addition to an anatomist, but usually very well-known plastic surgeons and very, very well-qualified surgeons teach the course.
And an aesthetic practitioner as well.
Absolutely.
Well. Yeah.
And during that course, and again, this is how we evolved it. So initially, it used to be just the blood vessels of the face and the areas to avoid to be safe. But now it's hands-on, so people can inject neurotoxins. They can inject the PDO threads. They can actually see the result of their work while also learning safe technique. So it's actually one of my favorite courses.
Yeah.
It's one of the most important courses.
And see all the different skin layers of the skin, right? Like, yeah,
sure.
That's amazing.
That is an important course.
So for the students who come here, and as we've already talked about, it's very hands-on and they do injections here. What's the sort of chain of events afterwards? They go home, they're injecting their friends and their family, but maybe they have questions, they need follow-up. What does the progression look like?
So obviously they're going to take a level 1 botulinum toxin course. They're going to take a level 1 dermal filler. And again, I mentioned this earlier, a lot of the courses that we have were developed from feedback from our client base. And what happens at a lot of these programs is, the instructors say, okay, now that you've learned this, now it's time to get good. Go home, practice on friends and family. And that started to resonate. And we're like, why waste all that time? That can take 3 to 6 months. So we developed a program specific so they wouldn't have to only go home and practice on friends and family. This is our fast track program. It's a very, very intensive. It's only hands-on. It's after you've taken one of these level 1 botulinum toxin dermal fillers. And the program is, we give you an entire bottle of the botulinum toxin products. We give you plenty of filler, and all day The entire day, you're just injecting botulinum toxin. And then the next day is the entire day just injecting dermal fillers.
And really is learning from the same faculty members that train you at our programs, but it's in their offices. So it's actually, a more one-on-one
So
training.
what we were talking about earlier, training is so expensive.
It is very expensive.
Training is very, very expensive. The typical price, if you were to go out and do a one-on-one training, can be anywhere from $5,000 to $10,000. So what we devise is this fast track where it's essentially small groups of people. There's maybe 3 to 5 students in the room, and they're working directly with one of these practitioners. Either it's in a small setting, but it's in their room, it's in their office setting, and it's almost like a mini preceptorship. So the person is getting intensive hands-on, plenty of product, and it's in a very, very small setting.
And another thing that we can add is that since they already met them at our programs,
true.
they can choose whoever the instructor they wanted to be and go to their practices. So really learn a lot from them, not just on the injectable side, but also maybe how to run, a business because they're going to be at their practices.
Very
so I
true.
think that's another plus for the fast track.
I'm just thinking about that post support, the post, seminar support. We work closely with our practitioners. We really try to get as much feedback as we can, and we create this, for them.
And I truly believe safety is very important. Nobody wants to have a complication. So safety is the most important thing. So having more hands-on experience at least will help you avoid, complications in the future.
We also have our live mentor, and this is when the person will follow up. They have questions. There's always questions that they have after. And we have a Zoom platform where the practitioner is asking their questions to the doctor or the nurse, whoever's teaching, and it's a great way to get your questions answered. So that's something.
Yeah, because to your point, you leave here and you go, oh, I forgot the one thing, or I was supposed to ask this.
Yeah, that's right. There's no other way to follow up with their question.
Right.
And too many of our students and practitioners, they call and they're like, I had that one more question. How do I reach that doctor? Now they can reach that doctor, instructor.
Lorena, Doc, thank you so much for that conversation.
Well, that was fun.
And if all of you watching want to learn more information, comment, like, share, subscribe, do all that stuff. Go to the website. Tons of information out there for you to learn more about Empire Medical Trading. Write them, come visit them, hang out.
That all sounds like fun. Yeah, thank you.
Thank you.